We are talking about depression, which is a very serious medical ailment, and the clinical presentation has already been discussed. A patient basically comes to you and he has a lack of interest in life, and a lack of energy is going to be observed in such individuals. And all of these presentations, these multiple presentations, are going to give a diagnosis of a depressed individual. Now, what are the risk factors, or what is the personality that is usually prone to such a medical ailment? That is again very important. There are a lot of risk factors, and sometimes there are a lot of personalities out there which are more prone to these depressive episodes. So we're going to discuss what are the physical ailments. It can be even a lot of drugs out there that you're usually giving as a medical intervention in a lot of other diseases, in a lot of other ailments, and these drugs can even be found to be the cause of depression in a lot of individuals. So these risk factors are going to be discussed over here in this section. Now, we are going to discuss the socio-demographic factors. First of all, the socio-economic status is again very important when we are discussing it. Economically, the person is going to be affected, and the social circle is also going to affect the person and the moods of the person. So this is another very important factor that we are going to discuss over here in this section. Then we are going to discuss the psychosocial and the biological factor. So there are a lot of psychological factors that are going on. They can be drug related, they can be related to some ailments, and that is what we are going to discuss over here. Biological factors, including the gender of a person, including the age of a person, that is also going to be discussed. Then we have the psychiatric comorbidity. That we're going to discuss over here. Comorbidity are basically the different states when they multiply together and they're going to present as a depressive episode. So that is the main crux of this section. Then the predisposing factors for depression. There are a lot of predisposing factors out there. They can be environmental, and they can be the personality traits of the person himself or herself. Not necessarily causative, but they are found to be the risk factors. Sometimes they are present in a lot of cases, and sometimes they're not even present there. In the milder cases of depression, they are usually related to the psychosocial factors. And in the more severe cases, the greater biological component is being observed. So when we talk about the causative factors of this depressive episode, it can range from the milder forms to the severe forms. So a lot of studies have been carried out in a lot of clinical cases suffering from the milder forms or suffering from the severe forms, and it was found that in the milder forms the main cause is socioeconomic, while in the severe forms it's the biological component that is more of the causative factors. So the biological factors are very important when we talk about the severe cases of depression, and then there are the environmental factors, the social class that the patient belongs to. Then the demographic knowledge is again very important. A complete history is basically going to give you an idea about the person, about the environment of the person. Then the social circle of the person is also going to be investigated. In such a case, the close friends, the family, the relatives are going to also give important history and important points about the personality trait of that individual. Now, the non-environmental factors such as the drug-related depression is another phenomena that is quite commonly seen. So even this is going to be kept in mind whenever we are investigating a patient, or whenever we are taking a complete history from a patient and we want to make a complete diagnosis in a particular case. The socio-demographic factors that are quite important over here, they can be the female gender is usually more prone, and the adult age group is more prone to this depressive episodes. Then the marital status, usually it is quite opposite in the females and the males. Basically the single females are usually going to lead a happier life, and they are not going to face the depressive episodes. And while the when we talk about the male population, it's basically the population which is usually married, and is leading a more happy life in the male status. Now, the unemployment is one of the causative factors over here when we talk about depression. So it can vary from males, and as well as females can also be affected by this unemployment factor. And then there is the lower socioeconomic status. So it's another causative factor for depression. Urban area of residence, people living in the urban area are going to face more depressive episodes than born after 1950. So depression was not a major ailment before 1950, and that is again the hustle and bustle of life is basically the causative factor over here. Then we have the biological factors. So even there are a lot of biological factors that can prove to cause depression in a lot of individuals. There can be a genetic predisposition and low birth weight, or even some childhood history is going to pinpoint about the factors which can lead to depression. Then we can have the psychosocial factors that usually include the early loss of mother, to which the patient was not even attached to or didn't find time to spend to have that bonding relationship with the mother or the father. So that bereavement phenomena is going to be seen in such individuals. Then the social isolation is another phenomena which is seen in the adult age group. So it's quite common when this phenomena is basically known as the empty nest syndrome in such individuals. Then we have the childhood sexual abuse. So if you take a complete history and a detailed history is taken, you will come across that there are a lot of factors and there are a lot of incidents in the childhood of the person that is going to make his personality prone to such depressive episodes. Then we can have the psychiatric comorbidities as well. The alcohol misuse, the people who are using that, who are having that substance abuse, they're going to have the comorbidities with depression. Then we can have people with anxiety disorders or panic disorders, the agoraphobias and social phobias, the somatoform disorders and the eating disorders. All of these, whether it is the bulimias or the anorexia nervosa, all of these can present as comorbidities with depression. So the viral infections, people suffering from viral infections, HIV or cancer, terminal illnesses, they basically suffer the depressive episodes because they are basically incoherent about their future. So that is why that is going to highlight the fact that their terminal illness is the basic cause for their depressive episode. The diabetes, or people suffering from diabetic or cardiovascular diseases, if they have stroke or epilepsy, or they are suffering from arthritis or cystic fibrosis, which are basically the chronic illnesses. And then we can have the chronic obstructive lung diseases. All of these illnesses are quite debilitating for the individual himself, and he's going to suffer from a depressive episode finally. Then the prescribed medication. So a lot of medications can be the etiology of depression. Steroids are usually the cause in a lot of cases. And then we can have the calcium channel blockers, beta blockers, and digoxin and opiates. So all of these are basically depression causing agents. And sometimes a lot of individuals who are on long-term therapies with these drugs present as a depressive episode. Then there are a lot of miscellaneous causes to it. There can be a chronic pain, the use of cannabis or psychostimulants can be one of the causes. Then we can have chronic smokers, people who have the gambling habit, and then the pregnancy or childbirth, which is basically the postpartum depression. And then the obesity, that is the weight gain, can be one of the cause of depression. So all of these are basically the risk factors when we talk about them, and we have classified them upon their etiology. Then the rates basically exhibit no gender difference, and the rates in females are basically predominating. They are associated with pregnancy, and they're also associated with childhood history. So a complete history taking is again very important, as I've already emphasized upon this fact. Over here, there's going to be a lower self-esteem. When you talk to that person, you get the detailed history from that person, and you asked what he feels about his own image. He's going to give the negative comment comments or negative thoughts are going to prevail in his speech. So that is basically the highlight that he's suffering from the depressive episode. Then there's another phenomena, the self-blaming cognitive styles. So the thinking process is going to be quite negative, and he's going to self-blame, or he's going to be in a guilty conscious state. So that is going to highlight his depressive episode again. Then we have the difficult socio-cultural roles, the socio-economic background, as we were already focusing upon this fact that it's very important that the social background, you get a complete history from his friends and his family and his social circle about his personality traits. Talking about the psychosocial factors, it can be a death of the closed one, or the relative, or the mother or the father are the major pivotal roles in the life of a person. And then we have the events affecting the parent-child emotional bonds. It can be the separation of the parents, or even the long-term, long-distance relationships. That is, the father or the mother is in a long-distance relationship with the child. It is going to affect the personality of the child finally. Then we have the parental separation at one hand, and we have the dysfunctional parenting, that is due to the distance or due to the lack of time, the busy schedule of the parents, and the basically lack of spending quality time with their children. It can be one of the causes of depression in the individuals. Then we have the childhood abuse, that is the sexual, or it can be of the physical kind. All of these abuses can basically make the personality of the child prone to depressive episodes. The contributions of depression are quite common over here. We have the loss of relationships. Either there is a separation of the parents, there is a dysfunctional parenting phenomena. All of these are going to contribute towards the depressive phenomena over here. The loss of the physical health, the person is suffering from a terminal kind of ailments, or there is a physical comorbidity existing that is going to affect the health of the individual. It is going to basically affect the mental state of that person in that state. Then the loss of livelihood is again going to be there, which was marked by the energy, or which was marked by the loss of interest in the life and the daily workouts and the hobbies of that person. Then there's going to be a loss of prestige, and as well as the negative thoughts about the self-esteem of that person, and the self-imaging of that person is also going to be affected in such states. So basically, the reactive depression is basically a kind of depression which is not getting treated, or which is not going to show any signs of positivity. Even after further treatments and even after repeated treatments, the person is still going to be in a state of depression, which is secondary to adverse circumstances. It can be any circumstances which he has went through. It can be a post-traumatic stress disorder. A major event in his or her life is marked, and basically after that event, that depressive episode is seen in that person. That negative thoughts are going to be seen in that person. The symptoms are often less severe in that individual, and their lacked somatic or biological symptoms are also going to be seen in that individual. Then we also come across this endogenous depression. So this endogenous and reactive depression are basically the interrelated terminologies. By the person's innate biology, it is going to be marked in such a state. Then we can have no clear external causes in such a case, and there's going to be a greater severity of depression in such individuals with endogenous depression. The somatic symptoms, the appearance of the somatic symptoms is going to be quite common in such individuals. The depressive disorders are of a single category when we are talking about such psychosocial factors. Then there are a lot of biological factors that come into play when we talk about depression. The biological factors can be that the person is suffering from diabetes, or he's suffering from hypertension, and it is more higher in infants. If it is a type 1 diabetes, or he's suffering from diabetes from the childhood, he's going to suffer from that depressive episode. Then the dysfunction of the hypothalamic pituitary adrenal axis is again very important cause of depression. The genetic components are going to be seen and looked for. They are small compared to the environmental factors, and they play a basically the environmental factors, they play a pivotal role in the etiology of depression. The genetic components with more severe depressive episodes basically increases the risk of depression. Then there are a lot of states which are basically known as the psychiatric comorbidities, and when we talk about them, the comorbidity of the depression, it can be the alcohol consumption, or it can be any substance abuse, and even cannabis is associated with this. And the use of cannabis, even the people who are using cannabis, they are more prone to depression. The primary chronic alcohol abuse is one of the cause over here. And basically, the person is suffering from a persistent chronic low mood. So that is the main clinical presentation that he's going to come up with. The miscellaneous factors, when we talk about them, it can be the smoking phenomena. Then the person may have a history of gambling, and he may also tell you or give you a history of illicit drug usage or substance abuse. And then we can have the link with the obesity, that is the complex chicken and egg situation. And basically the person is obese, he has gained weight, and when he goes into depression, he gains more weight. So it's basically a vicious cycle that starts off after that. The mood disorders in pregnancy or the postpartum depression after the childbirth is a common phenomena seen in a lot of individuals. So in this section, basically, we discuss the risk factors that will make the person more prone to the depressive episode. So that is the end to this section. Thank you for watching sqadia.com.